So patients with short necks or conical necks, it's always been a challenging subset. And traditionally what people have tried to do starting in the early part of this decade were fenestrated devices. Then people have started to use off-label approaches with commercial devices, now known as CHEVAR or chimney EVAR. And then most recently using the Aptus stapling device with commercial devices. The problem with all that is that with fenestrated you're having to treat the renal arteries, and there ends up being risk of renal stenosis and occlusions. When you do chimneys, you still have that problem, as well as coming from above, you have the problem of stroke. And now we have the Aptus stapler, and with the stapler, we just don't know the long-term data set. Will there be fatigue issues with the staple to the aortic anatomy? And we know with self-expanding devices, they grow over time. So what's going to happen as the aorta grows, and that staple is there in place. So we're hopeful that the Ovation IX, we now have 5-year data, and many of the patients treated with fenestrated devices, chimney devices, and in the Aptus trial, all would successfully be treated on label with the Ovation platform. So they're very different. Almost every other platform involves a self-expanding stent with either nitinol or stainless steel as a frame to attach it to the vessel wall and push outward force on the vessel wall, which in all those devices leads to the neck to grow. The Ovation platform separates the sealing and fixation mechanism, and so it uses a polymer-based seal that's put in after the device is introduced. That polymer creates a unique seal like an O-ring into the neck, and the amazing thing about that is it doesn't put chronic outward force on the neck, so at 5 years we don't see any dilatation or growth of the neck. So we know that patients with short neck anatomy with commercially approved EVAR devices have inferior outcomes. That's led us to do new and improved things. That's where FEVAR came out and CHEVAR. But if you don't have to go into the renal arteries, if you don't have to come from above, and you can eliminate the risk of renal-related events or stroke, it really needs studied. We really need to start comparing these different technologies to see, can you get durable outcomes and which treatment method is going to be the best. So the Ovation graft now has 5-year data. In the Encore data set, it now took 6 different studies, put them all together, and we see that really outstanding results, some of the best ever reported for any device through 5 years, but the platform still needs to evolve. We're hopeful now with the Alto platform, we now take that sealing where it's centered at 13 millimeters below the top of the fabric, or 13 millimeters from where the renal arteries would be. It's now moved up to 7 millimeters, and in doing that, it's going to expand the anatomic patients you can treat to really treat more of these short neck patients successfully with an infrarenal device. So the biggest difference is the moving of the sealing ring, and really the clinicians who've used the Ovation platform have pushed to say, well, instead of having it 13 millimeters below the top of the device, how do we get it closer? Really the other things relate to the engineering principles to do that. And so in doing that, the nitinol ring that was at the level of the renals is gone, and so now a balloon is put into the delivery system to help open up that device, as well as to be able to mold that polymer as you instill it. And then some webbing to separate the limbs to make it easier to get into the contralateral gate.